Hello and welcome to the Paediatric Cardiology Psychology Service webinar series. My name is Amy Woodham and I'm one of the clinical psychologists in the team based at the Bristol Children's Hospital. Today I'm going to be talking to you about managing the impact of a cardiac condition for parents. With regards to the aims of the webinar today, this isn't designed to be an individual or a group therapy, but it is designed to be an information resource and a space to think and reflect about some of the advice that might help coping. Unfortunately, we're unable to provide specific advice within this forum for your own child or family member, but we will outline contact details for further support and immediate support if this is required. In terms of looking after yourself, some of the content today may trigger some difficult emotions or things that remind you of different experiences for you or your family. And depending on how things are for you at the moment, these may be closer to the surface or not. So we'd really encourage you to take a break and to stop watching if you need to pause or revisit another day when you feel ready to. And it may be helpful for you to think about having something to do after today or identify somebody that you can speak to, especially if you've noticed yourself becoming distressed during watching. If you do want to speak to a psychologist in our team and are eligible for this, we'll highlight how you can do this at the end. In terms of the timing for today, the webinar will last about 30 minutes, and we would really welcome your feedback so we can make these webinars as helpful as possible. In terms of the experiences of some of the families that come to the paediatric cardiology service, we understand that receiving and living with a diagnosis of a heart condition within a family will be a different experience for each child and family. And it's absolutely normal to experience lots of different thoughts and feelings about this, both positive and negative. And it's important to recognise that this is likely to be a stressful time for you as a parent, and it's understandable to be feeling nervous and apprehensive. So we hope that this presentation will contain some ideas from the psychology team in terms of supporting your own well-being after your child has had a diagnosis of a heart condition. And we will be covering other themes in the other webinars as part of our series listed here. These are some dates for our live webinars. However, as you're watching this pre-recorded, these may have already gone by, so please keep an eye out for these recordings if they would be relevant to you. We have a webinar on supporting siblings of a child with a heart condition, a webinar on supporting your child coming into hospital, and finally a webinar talking in a bit more detail about mindfulness, but we will talk about some of the themes about that today in the context of looking after yourself as a parent. The diagnosis of a heart condition in childhood will, of course, be a significant adjustment to any family, and this period of adjustment will look different for everybody. In our clinical work in the psychology team, we often use the roller coaster metaphor when thinking about adjustment, whereby families will likely experience a range of emotional experiences which may be present over time. This might look like feeling angry and upset one day to accepting the other, and this might change from one day to the next quite quickly, or it might look very different to the next person. There's also the potential for difference in the adjustment process and time of adjustment between different members of the family, including between partners, the child with the cardiac condition, and their siblings. So we acknowledge that it's an ongoing process where a number of different events and time points, some of which are listed here, for example, the diagnosis, treatment, monitoring, any intervention, potentially discharge from hospital, any changes to routine and structure, waiting for appointments and medication regimes, to name a few. There are, of course, so many different events and time points which families will experience that can impact on the process of adjustment and may take us back to process of adjustment that we might not have experienced for some time, or we might experience these new events in quite a different way. So it might be quite easy to clarify the triggers or a cause of change emotionally, but sometimes it might not. Sometimes it might not fit with the current experiences, and we certainly meet with some families who sometimes are able to reflect and acknowledge that perhaps as the dust has settled, as some people say, the adjustment process can take on a whole new form when things are a bit quieter, and there's something about stopping firefighting that's allowed them to reflect and to think about all that they've been through. This quote here is a phrase that we use very frequently in our work, which is to acknowledge that emotional reactions to cardiac conditions in childhood are very often really normal responses to a not normal situation. However, just because we would understand this as being a normal process, which might include different emotions and feelings like anger and sadness, maybe guilt, this doesn't mean that you can't, or your child can't, ask for further support from the team if you're eligible for this within our cardiac network. It's really important that we recognise and compassionately respond to our emotional response, however this shows up. In terms of context, we know that there are a number of contextual factors in our lives that will influence on the adjustment process. We can draw upon and reflect upon our individual experiences. This might include thinking about previous experiences of hospital, accessing healthcare, relationships we have with professionals, other people that we might know with a cardiac condition and their experiences. And all of these things, understandably, will impact on our thoughts and our feelings and our experiences. We all have a range of everyday stresses: work, siblings, school, other caring roles, to name a few. And living with uncertainty for many families too, and this might be in a number of domains, including finances, medical, and illness. So we know that the context of a cardiac condition will impact on all areas of life, and we know that these do not necessarily stop when your child receives a diagnosis or has to have treatment in hospital. So how do we notice when we're stressed or anxious? For some of us, there might be some clear signs and signals that we're able to identify that we're having a difficult time. And for others, it might be more tricky to identify these, or it feels like it all accumulates and can feel very overwhelming. We know that stress can build up and that it might be quite difficult to notice this at first. It might be difficult to notice some of the warning signs. And this is especially true for many of the parents that we meet, and for many people in general, when we try to cope by keeping busy. We know that keeping busy, being distracted, is really functional in a way of keeping us going. It can be quite a protective strategy and a way of coping, and there's certainly no concerns with using that some of the time, but when we might want to think about doing things a bit differently is if that's our one way of operating, our one mode of coping, because ultimately what we can see and recognise is the consequences of this are feeling exhausted and burnt out. So we use this term, there being an unintended consequence. So the intended consequence might be to keep busy, to focus, to have other things to concentrate on as a way of managing such a difficult situation. But the unintended consequence is that without rest, without periods of relaxation, without time to reflect on how we are, the unintended consequences are that we might be burnt out and be making ourselves unwell. We can recognize, however, though, that this autopilot mode serves as having a disconnection from reality in some ways, and this is a really very well evolved process in the brain that's been going along for a long time. It's our brain's way of helping us cope with stress and anxiety. It helps us focus on the thing at hand and not have to acknowledge in so much detail and so much depth about all of the other things that are going on. So certainly there is a protective function to this, but it's certainly worth taking a step back to think about what are some of the consequences of that maybe being the one mode of being within. This is a diagram that describes some of the impacting factors on stress. It's taken from the cognitive behavioural therapy model, which is known as CBT for short. And we will often use these kind of diagrams in our conversations, in our work as psychologists, as a way of taking a step back alongside the people who we're working with and trying to make some sense of reactions and behaviours and different thoughts and feelings and how these might all be cumulatively together impacting on our emotional experience. So, for example, we might think about preparing as a parent for an admission to hospital or an appointment. Some of the physical signs we might notice are feeling pain, maybe tension, headaches, stomach problems, to name a few. So some of those physical signs in our body. Some of the thoughts might include feeling overwhelmed, having difficulty concentrating, maybe some thoughts, what if thoughts, some what we might call catastrophic thoughts, our brain getting quite noisy and going to the worst case scenario. And our behaviour, it might result in behaviour such as not sleeping or appetite changes, feeling quite irritable, perhaps using substances like alcohol and smoking, perhaps feeling more tearful, withdrawn from others in our life, or maybe quite indecisive and finding that our usual problem-solving skills are impacted. So this can accumulate ultimately in stress, and within this there are a number of feelings like anxiety and worry, low mood, anger and frustration. So this gives us the opportunity to make sense of what's going on when we're feeling stressed. What are the signs? This exercise has gained a lot of attention in recent years. It's derived from a type of psychological therapy called acceptance and commitment therapy, and it's called dropping anchor. Dropping anchor acknowledges that our emotions are a bit like a sea, the ocean. Sometimes it's calm and it's peaceful, sometimes it's a little wavy, other times there might be really big storms which we can attach to certain events that are happening in our life at the time, perhaps. And these really rock the boat, and we can view ourselves as being the boat. So the emotional storm, that can refer to all of the difficult thoughts and feelings, emotions and memories that we are fused with in that moment, that we are focused on in that moment. But like real waves in the ocean, it's important to remember that our emotions do come and go and are always changing. So in terms of dropping anchor, the focus here is trying to stop the boat, the metaphorical boat, from going too far off course. When our emotions feel really stormy, we can use this practice to drop our anchor. And this is using a range of skills that we can utilize in any situation because it takes a number of minutes. It helps us to ground ourselves in the present moment, to be here, right now, at a time when our brain and our emotions might be pulling us to hypothetical what ifs, might be thinking about things that have happened in the past, and we might be moving towards two different time frames in quite quick succession, which can feel understandably a really exhausting place to be. Our brain's kind of doing its thing. It likes to mull over what's been and what might be, because in many ways it can feel quite a productive and proactive thing to do, to think back or to try and problem solve. However, in terms of our emotional well-being, we often think about all we have is now, and to ground ourselves back to the present moment is one way in which we can try and do this. Apologies, I just realised that I hadn't moved on to the next slide then, so here's the slide for you to pause and read if you would like to. So what do we mean? What does it look like? Well, here's one of the exercises, and I'm not going to go through it here, but I would encourage you to take a more detailed read of this, to press pause, and there are lots of videos on YouTube also that can provide some guidance through doing this exercise. With all exercises, with all practice, we encourage you to revisit it and keep trying and keep practicing. As with so many things in life that we might attempt for the first time, we know that they require practice for us to become more skilled and for it to feel more natural to do something that's a bit different for us, which is completely understandable. We wouldn't expect someone starting running for the first time to run a marathon, and the same principle applies here. The key principles are about taking a moment, taking a pause, taking some deep breaths through your nose and through your mouth, in through your nose and out through your mouth, or a rhythm that feels comfortable for you. Try not to do anything too different, just finding a relaxing rhythm that works for you. Trying to really notice on how each breath relaxes your body. Perhaps it might feel comfortable to put a hand on your stomach. Some people like to use the imagery of imagining a balloon inflating and deflating as their stomach expands, to anchor themselves in that moment. And once you're feeling settled, to acknowledge what's showing up for you, what's showing up inside of you, what are the thoughts and the feelings, the emotions, memories, sensations or urges you might be having in that moment. Just to kindly acknowledge, not trying to do anything, just noticing what's going on for you in that moment. Then moving on to connecting with your physical body. And there are a number of ways in which you can do this. You might straighten your back, lengthen your spine, notice where your body connects with the chair. You might gently stretch your arms or your neck, give your shoulders a shrug. You might press your fingertips together, and all whilst trying to maintain that soothing breathing rhythm. And the third stage is to get a sense of where you are and to refocus your attention on what you're doing. So you might, as a way of doing this in quite a practical way, use your environment around you to really try and hone in on what can you experience in a sensory way in this moment. What can you see? What can you hear? What can you touch? What can you smell? What can you taste? It gives some guidance here about 5, 4, 3, 2, 1 things here, but it's not about getting too tied up in that. Find something that works for you. Maybe it's harder for you to access some of those senses, so maybe you want to pick a few if that feels more manageable at this time. We often meet parents who, when we visit the topic of self-care and well-being and looking after themselves, whether that's parents that we might meet on the ward or parents who are out in the community that we might see on an outpatient basis, when we visit this idea of self-care, lots of difficult emotions can come up, a range of beliefs about what it means to look after oneself and prioritising that in one's life. We know that there are a range of ways that we can look after ourselves, and some of these things are universally useful. They're recognised as being the basics of well-being that are helpful for us all to take a step back and think about how we're engaging with or not, and what might be helpful for us to move towards doing more of the things that we know are good for our mental well-being. And there can be a range of quite quick strategies, but also some more longer term changes that might require a little bit more coming back to and prioritizing. We can use the metaphor of the oxygen mask. Probably most of us who have flown before hear this statement by the stewardesses when they do the safety briefing that states that we need to put on our own mask before we can help others. And in this context, we're thinking about if we run out of our energy, what keeps us well, what keeps us going, we are just not able to help others effectively. It helps us to look after our children in looking after ourselves. And this is, I think, a really helpful metaphor, particularly for those who spend such a lot of their time looking after others. It's so important we make room for ourselves too. We know that there are such a range of coping skills and strategies, as I've said, and also, as I mentioned earlier, some of these can have intended consequences, but also unintended consequences too. So, for example, the use of alcohol as a way of blocking out what's currently happening, or keeping very, very busy, but ultimately it's keeping us in a place of potentially moving towards being very exhausted. So we need to think ultimately, if we can, flexibly around thinking what helps us. And as I just mentioned, there are some universally recognised ways of keeping ourselves well, and this campaign by the NHS, 5 Ways to Mental Wellbeing, was one way of clearly stating some of the aspects of our life that the research and the evidence shows us are really important for our mental well-being. There is much more information available on the NHS website if you type in 5 Ways to Wellbeing, and there'll be a link at the end of these slides as well. But it talks about these 5 areas in terms of how we connect with other people. This might be people who we've known for a long time. This might be connecting with other parents who are in similar situations to yourselves. Trying to remain physically active. We know that there are many challenges to this, particularly during hospital admissions where leaving the bed space might feel a really tricky thing to do, but we're always really encouraging of parents to take breaks, to have opportunities to move. We know that in supporting our body manage stress, one of the best ways we can do this is to move our body, to relieve some of that stress and anxiety, and to promote some of the positive chemicals in our brains. Learning new skills, giving to others, and paying attention to the present moment, which links in with the exercise before about dropping anchor. The purpose of that is to tune into this moment, not pushing away, but just bringing ourselves to a place of contact with the present moment. This image reminds us of the range of activities that are recommended in terms of keeping what it calls a balanced boat. Another boat analogy here. So some of the tasks in our life will, of course, be routine, things like the school run, different aspects of kind of running the home, other routines that are part of your family. There'll be other necessary tasks as well. These might be tasks that you might have been putting off, conversations you might have been putting off, or other activities and things that you need to make, or you would like to make time for, but have been very tricky potentially, and also pleasurable activities. So the things that bring you a sense of enjoyment and pleasure, and these will be inherently different for each of us dependent on our hobbies and our interests. And sometimes we know that remaining connected with these can understandably be really tricky for parents. So we need to reflect on how can we allocate even really small amounts of time to doing things for you. We know that doing things that are pleasurable will help us feel more positive about tackling tasks that we feel are stressful. What we can see emerging very often is that the idea of doing pleasurable activities, maybe for parents who are on our cardiac ward or in the community, it can feel quite wrong. There can be feelings of guilt that might emerge and quite difficult thoughts about doing that. The idea of looking after ourselves instead of others. But using this analogy, we know it's so very important. in balancing our boat. And if we can find the time, even small pockets of time, to do enjoyable things, then it helps us break these cycles of low mood and stress and anxiety that might arise the more we neglect this. Relaxation. Why? Because we know that when we're stressed, we have lots of physical feelings in our body that can give us the signs. As I said before, some of us might be quite tuned into these, and for some people it might be trickier, or the signs might feel a bit different. But typically we might experience muscle tension in different parts of our body, in our neck and our shoulders, maybe increased headaches, and this can cause uncomfortable body feelings. We know that a range of different relaxation techniques are available, and for each person, the kind of relaxation techniques will vary, of course, but we can think about things like doing breathing exercises, and that might include just having a couple of minutes, maybe a slightly longer exercise where we tune into our breath and our body. And there's lots of really helpful YouTube videos available. Also, there'll be a link at the end of this presentation. Or for us, relaxation might feel like more of a thing that's comfortable when we're doing. So we might have various soothing activities or relaxing activities that make us feel peaceful, soothed, and connected to the present moment. So this might involve things like having a bath, reading, listening to music, walking in nature, swimming, knitting, painting. I could go on. You'll know, hopefully, what are the things that you like to do, what help you relax. And so this will be very different for everybody. How can you make room for even small moments and pockets of connecting to these relaxing activities, and how to prioritize them as being important for yourself and your well-being? Understandably, some situations make drawing upon these activities much more challenging. So, for example, during a hospital admission. So some of the things that you can think about, or think about with other people in your life, your team, or maybe a member of the psychology team, would be about how you can adapt or change some of these, or utilize new skills to meet the demands of the hospital environment. Just a brief word about sleep. We know that, again, this is another basic need that can be neglected when we're stressed or busy or anxious. Our routine for sleep might go out the window, or sometimes this is the first sign that we notice that we're feeling more stressed, the disruption to our sleep. We know that having breaks, eating well, exercising are going to give yourself the best chance at getting a good night of sleep, and help you or make you feel like you have the resources to cope with the difficulties you're experiencing. And if you are having significant difficulties with sleep, I encourage you to have a look at the NHS website about sleep support, and also to speak to your GP as well. Understandably, managing uncertainty is such a core experience of so many of the families that we work with, and there will undoubtedly be many periods of time during your child's care where this will be around, and this might be waiting for results or waiting for the best time for a surgical procedure. And some of the strategies that we might usually rely on when things are uncertain, like planning or problem solving or gathering information, might have limited effect. So working out what's helpful and not helpful for you and your child's well-being at these times is really important. As I said earlier, there's clearly a helpful function in many ways, of our brain's ability to problem solve, to think about different situations, to mull over what has been in the past and what might be. And this is why it can be so difficult to feel like we can let go of worries, because in many ways it can be helpful to us. We might have questions like, or feelings about kind of, forgetting important things, or needing to ask the right question, or beliefs about what it might mean about us as a mother or a father or a carer if we're not constantly thinking about what's going on and planning ahead. So again, we revisit here the oxygen mask metaphor about how we make room to prioritize our self-care. Some of the strategies that might be helpful to consider if you haven't already is having a worry time. And this helps put some boundaries around the time that you spend thinking about the things that might be out of your control ultimately. And this worry time might be a space that you share with somebody else. It might have a certain time each day, or at certain periods within the week. It might be a family ritual using something like a worry jar where different family members can put their worries in the jar, and there's a protected time to talk about the worries, to think about the worries together. If it feels like worry is something that's happening all of the time, or you're responding to worries from your child, and this helps put a bit of boundary around it in a way that might feel a bit more helpful. Some people also find the use of worry trees quite helpful. As psychologists, we understand worry as a cognitive process, which is a fancy word for thinking process, and worry involves thinking about problems that might happen in a way that can sometimes leave us feeling anxious or apprehensive about what's going to happen. Some people experience worry as helpful. They might have beliefs about it, letting them anticipate things that might happen, or obstacles, and processing information. But for some people, they might experience their worry as much more frequent and uncontrollable. And this worry tree is a guide in many ways to help distinguish whether we're experiencing a real life event or a hypothetical worry event, and then to engage in problem solving or distraction and worry postponement. So it asks you a series of questions and helps you make decisions about your worries, helps you to challenge worries and decide if you can control them or not. Thinks about ways that you can distract yourself from worries and move on with your day, and create an action plan to take control of your worries. As I'll mention shortly, if worry is feeling uncontrollable, we would really encourage you to speak to your GP, who will be able to hopefully signpost you to local talking therapy service, who can support with these kind of themes when worry feels uncontrollable. Also, our service too will often work with parents who might be experiencing worry and uncertainty in the context of their child's cardiac condition. And we would be happy to think with you about which services might be best to meet the needs that you have at present. As I've said before, worry jars to open at a worry time in the family context, or writing down your worries might be a helpful way of talking about and giving space and boundaries around worry. Letting thoughts go is certainly easier said than done. What we know about pushing away our thoughts or trying not to think about things that are difficult is that it can ultimately make them more difficult to ignore. As an experiment, very briefly, for the next 10-20 seconds, I'm going to ask you to think about anything that you want. It could be what we've just talked about, maybe a conversation you've had with a friend, what you're doing later, what you're having for dinner. But I don't want you to think about a pink elephant. So whatever you do, don't think about a pink elephant. Okay. So how did you do? Did you think of it or not? When was the last time you thought about a pink elephant? I think this is quite a helpful example of our attempt to suppress, to stop ourselves from thinking about things, makes it more likely for them to surface. It's much easier said than done. We can also use the analogy of pushing a beach ball underwater in a pool, for example, and how we can sustain that for so long, but ultimately that pressure increases and increases and can feel quite uncomfortable, in that the beach ball is likely to ping out of the pool, and that beach ball can represent our stress, our difficult thoughts and feelings. So in terms of letting thoughts go, we're thinking about how we can notice when we're having thoughts and trying to refocus our attention. And there's so many guided practices available through. We haven't had a chance today to talk in much detail about mindfulness, but many people are talking about mindfulness in recent years. There's so many books and information on the internet and guided practices on YouTube available too. There are many everyday opportunities that we can refocus our attention when thoughts are arising, as a way of being along beside them, not necessarily pushing them away, but redirecting our attention in a way that might be more helpful to us in that moment. So it might be about eating something and really thinking with our senses about the texture, the taste, the temperature. Is it bitter? Is it cold? It might be about taking a walk and really focusing on the pressure of our feet hitting the concrete, how we can feel our sock and our shoe, what the temperature is like, really being present in that moment. It might be washing up, and as I said, really focusing on the senses. So there are many everyday opportunities, even in very busy lives, where we can take a few seconds and a few moments just to bring ourselves back to the present moment. If you're looking for further support after listening to this webinar, and hopefully some of the other webinars in this series as well, you are very welcome to contact our service if your child is a patient of the cardiology team at the Bristol Royal Hospital for Children, and the area that our team cover. You can inquire about additional psychological support by speaking to your child's team in an appointment, or by contacting our psychology admin directly, and a member of the team can contact you to discuss your support needs at the moment in more detail and think with you about what might be helpful. You can also speak to the cardiac clinical nurse specialists, who we work very closely, about psychology, and also to make you aware that you can access the play team and chaplaincy as other sources of support. We've produced some wellbeing toolkits, and these are for parents, children, adults who are accessing care in the hospital, and for teenagers. And they cover a range of topics that will be relevant, and some of which are being discussed in a little bit more detail as part of this webinar series. And you can go to this link here, or go on the Bristol Children's Hospital website in the psychology section under resources, and you can find the links there. We really hope that listening to this webinar today hasn't caused too much distress for you, but in the event that you feel like you would benefit from more immediate support, or if you feel in a crisis, there are a number of contacts that you can use that are listed here. If you feel at risk of immediate harm and you live in Bristol or Weston, you can contact the crisis support team on or 999. Their telephone number is listed there. But if you live outside of Bristol and Weston and do not know the number for your local crisis team, please do call 999 or attend A&E if you feel able to. There are other sources of immediate support as well. You can contact Samaritans on 116123, or text shout on 85258. And both of these services are to provide a listening ear at times of need. If your concerns and your experiences are within working hours, please do contact your GP, who might also be able to signpost you to other services locally. Here I've listed some further resources linked to what we have discussed today. There are some links to mindfulness and relaxation techniques. there is some further information about sleep management and the 5 ways to well-being. The final link is the Cardiac Network summary of organisations. These include charity organisations that might be helpful to connect with. I hope that today has been helpful for you to listen to. We really welcome feedback in making these webinars as helpful as they can be and as informative as possible. So we really do welcome feedback. Please keep an eye out for our email address that will be listed as part of this posting. So please do get in touch if you have any thoughts or comments about improving or things that you liked or thought could have been a bit different about the series today. But for now, I'll say goodbye and thank you very much for listening. Thank you.